Hey everybody, Dr. Khan here from OKC Fertility. Today I really quickly wanted to talk about what is called ovarian reserve. I get questioned about this all the time from patients. How do we assess ovarian function? How do we assess how you're going to respond to treatment? And what we call that is essentially ovarian reserve. There are a lot of pieces that we use to kind of create a good picture for that for any individual patient. And so we use a couple things. Most traditionally, the biggest factor that we use is chronologic age. We know that as a woman ages, her fertility potential just kind of decreases. Very crudely, we kind of think about that in terms of number of eggs or egg quality. Those things all decrease as we get older. Most kind of one of the bigger noticeable hurdles is 35, and then there's a little bit more sharp of a slope drop until late 30s and early 40s when we really notice a substantial decline in fertility potential. So chronologic age is a big one that we use. Other things that we use are some laboratory parameters. So there are a couple labs that we use. One of the biggest ones, one of the older ones, is called FSH, that's follicle stimulating hormone. And that is basically the hormone that comes from your brain that goes to your ovary at the beginning of each month and says, okay, it's time to develop a follicle. It's time to develop a group of eggs, one of which will become, or two or even possibly more, will become the mature ones that are going to ovulate. And so basically the amount of hormone that your brain needs to produce to go to your ovary to give that signal is our indirect measure of that's how we use that test to determine fertility potential. So the lower the number, essentially, the better, broadly speaking, because that means that your brain basically has to produce very little signal to go to your ovary to get it to start to develop that group of follicles. It's important that that's done at the right time of your cycle, so early in your cycle, because later on there's other hormones at play and it doesn't give us as clean of a picture. So we use follicle stimulating hormone. The other major lab that we use, it's a little bit newer, but looks to be very reliable, is anti-Mullerian hormone, or AMH. And what we think is that AMH is actually produced from the really small early antral follicles in the ovary, ones that are a few months out from actually being ready to ovulate. And what we think is that it kind of gives us this indirect measure of the size of the pool of potential follicles that are available to ovulate. And so for that number, we really kind of want it usually above 1. We say 1 to 3 is kind of the normal range. Some patients have values that are much higher, and that sometimes indicates a patient is on the PCOS spectrum. And again, that's just information that we use to kind of decide treatment and especially medication doses. So we use chronologic age. These are two of the labs that we use. Another parameter that we use is called the antral follicle count. So when we do an ultrasound early in the cycle, how many small follicles, small eggs do we see at any given time? And so normally we really want to see, at least above 5, probably more like in the 8 to 12 range. If that number is really low, then we're concerned that a fewer number of eggs is developing in a cohort. And then if we see a lot, that makes us potentially think again about that PCOS spectrum. Other measures that we use are really just a patient's history, a reproductive history. So when someone has had a pregnancy, if they've had proven fertility, that usually is something that helps us sort of look more favorably about the whole situation and ultimate success. But really, it's just very variable. It's very patient specific. We just try to use all of these little bits of information to kind of put together a bigger picture to say how we think somebody is gonna do in the fertility process. The truth is, though, you just need usually one good egg and one good sperm, and we can make it happen. So we're always hoping that we can just find that and have some good success. So hopefully this was informative. You can always find out more on our website, okcfertility.com, or look us up on our Facebook page or our Instagram. And we look forward to meeting and helping you if we can. All right, everybody, take it easy.